Hi, I am Dr. Nancy Carsley, and I am the Dean of the Dr. William M. Scholl College of Podiatric Medicine. And Scholl College is one of 5 colleges at Rosalind Franklin University of Medicine and Science. And I'm excited to tell you a little bit about podiatric medicine and the state of podiatry today. Podiatric medicine has been around for more than 100 years. Scholl College has been around for more than 100 years. Podiatric physicians, also known as podiatrists, are doctors who treat the lower extremity. They treat conditions of the lower extremity, primarily the foot and ankle. We are integral members of the healthcare team. We interact every single day with allopathic, osteopathic physicians, physical therapists, physician assistants, pharmacists. And again, we're integral members of the healthcare team dedicated to treating the patient populations. Some of the challenges that we face within podiatric medicine are certainly not unique to podiatric medicine. They are challenges that are faced by medicine and the health professions in general. The upcoming sweeping changes to healthcare that all of us will experience will certainly present both opportunities and challenges for everyone. There will be a need to care for many more patients than ever before in the past, with limited resources as well. And the other part of the challenge that we face is that patient populations are really changing in terms of the conditions that they're presenting with. Certainly within healthcare, we're seeing an increased incidence of diabetes, as well as increased incidence of obesity. We're seeing populations that are being impacted in ways that are very different from how they were impacted in the past. We know that obesity and diabetes are both becoming much more common in childhood, and that will have an impact on how those patients function for the long term. So certainly those are a couple of the challenges that we see, that podiatric medicine is very important in treating those conditions. Obviously the potential complications of diabetes include lower extremity complications, including ulcers and the possibility of amputations. So podiatric medicine is integral to trying to prevent those types of complications. Obviously, we want to care for those patients before they get to those extreme end results. Certainly with obesity, we want to make sure that we're keeping America walking. We need to keep people on their feet, and we need to keep people active. So that is another part of the challenge that we face. Some of the more shorter-term challenges that we face within podiatric medicine are also not uncommon to allopathic and osteopathic medicine. There are challenges right now with residency training. We need to make sure that there are a sufficient number of residencies for all physicians that are trained throughout the country, because that residency training is very important for practice opportunities. Within podiatry, we currently have an imbalance in terms of the number of graduates and the number of positions available. But the profession is very actively involved in trying to correct that imbalance, and it truly is expected that that imbalance will be corrected within the next 1 to 3 years, so that that problem no longer exists. Podiatric medicine is also challenged because there are differences in scope of practice across the country. So there is not a consistent, uniform scope of practice that exists within all states. In the state of Illinois, we do have the ability to treat both the foot and the ankle. The overwhelming majority of states throughout the country allow treatment of the ankle in addition to the foot, but there are a small handful of states that limit practice to the foot only. So that variability is certainly challenging across the country. But I would say the profession has evolved significantly over the last 100 years, and certainly within the last 2 to 3 decades. The education that students are provided today is better than it ever has been in the past. There is now standardization within residency training, which has been a significant improvement. Podiatric physicians are recognized as equal members of the healthcare team. And we have the ability to, based on our education, training, experience, and expertise, to really contribute to the care of the patient and to the future of healthcare. So podiatric medicine is a wonderful profession. It's an exciting profession, presents lots of opportunities, and it's been my pleasure to tell you a little bit about it.